Hi, I'm Dr. Ralph Joseph. I'm going to show you the insertion of hormone pellets, and on this particular video I'm going to show you the use of a disposable tray. In this procedure we always put the patient in a lateral decubitus position. I always rotate them so they get to be where I can see the majority of their buttock area. The landmarks for this are always the top of the iliac crest, and for the whole buttock area. You try to go more than anything, it's almost like a triangle. That's for the gluteus maximus muscle, okay? So you try to go medial to lateral when you're doing insertions over time. The place to stay away from is you can almost take the palm of your hand and put it below that. That area right there is the area that you want to stay away from when you're doing pellet insertions, because it deals with vessels and nerves. So you start out by just using your regular exam gloves. You ask your assistant, or for me, my nurse, I ask her to give me an alcohol pad. I identify the area that I'm going to do for my insertion. I prep that area with an alcohol pad just like you were doing a regular injection. This substance is called ethylene chloride. We use this a lot in sports medicine. The reason why I use it is because what you can do is when you get to an area about this distance, this solution will actually cause an area that actually turns into a little ice ball. That usually causes some stinging for the patient. I'll get my nurse to hand me, this is a 10 cc syringe. It usually has anywhere between 8 to 10 cc's of 1% lidocaine with epinephrine. And I start an injection by first making a small wheal in the skin, because I'm using a 30 gauge half-inch needle. One of the things that I usually do when I'm doing these procedures is I always put my thumb also as a landmark so I can see my area that I'm injecting. Then I trade off that 30 gauge needle, half inch, with a 27 gauge, 1.5 inch needle, and then I start doing the majority of my numbing at that time. I'll take the needle and I'll bend it almost straight down, and so you can withdraw that needle until you feel a pop. Then you know that now that needle is above the muscle, and then you can start doing your insufflation with local anesthesia then. When you do this, over time you're going to be able to basically go in and out. And I say this is almost like how you do this when you're doing a sewing machine approach. And all you're doing is making an area that you can palpate with one of your fingers, okay? So you know that that's now in the subcuticular part of the patient's buttock area. After you complete this part of the procedure, that's when you'll now go from being basically unsterile to a sterile procedure. How you doing so far? Okay?
Yeah.
Great. The other thing I always say when you're doing these procedures, if at the end of your putting in local anesthesia, if that needle is straight, then you know you've kept the right anatomy and the right technique. You take off your exam gloves. The next thing, when you're doing a disposable kit, everything that you need is inside this kit, okay? The one thing you need to make sure is that when you're opening this kit, that you're really not putting your fingers on the inside of that, and that you're basically holding it to where none of the stuff on the inside gets contaminated with how you're opening the kit. There is a set of gloves that are in this kit, but I have a tendency to always use my surgical gloves when I do these procedures. And so then I put on sterile gloves. And then basically for the rest of this procedure, I'm just using a sterile technique. So this kit, a lot of times what I'll do is I'll either pull the whole mail tray or everything all the way to me and keep this kit as close to the patient as I possibly can. The reason why I do that is because if you ever drop a pellet, it'll usually land on another sterile field. And then that way you do not have to go get another pellet. So when you look at this, there are sterile gloves that look like this, okay? I usually take those and put those aside somewhere. The next thing that's in here, this is actually a drape that you can use just like what we use in anesthesia when you're doing a spinal block or whatever. You can put this on the patient. A lot of times I never use it. Underneath that, you'll find 4x4s. You'll find steri strips that look like this. You'll find a Tegaderm drape. You'll find a small number 11 scalpel blade. You'll also find needles and syringes if you're going to draw these up, and then your trocar, and there's a little cup here that usually your nurse or your assistant can place your pellets on. And so I try to take all of that and get that as close to the patient as I can. The other thing about these disposable trays that I want to warn you about, especially on female patients, this trocar is not screwed in and it will fall straight out if you're not holding this in the palm of your hand, okay? If the trocar falls out and goes onto the floor, you're going to have to get yourself a new tray. So that's an important piece of information for you who are using this setup. So after the patient's been numbed up and given them enough time, then you get one of your 4x4s and your scalpel blade. And I always use this blade side up, okay, so you have more control of that. With a female patient, the direction is always straight in, straight back out. And I always test this area a little bit, okay? Do you feel any of this?
No.
Nope? Okay. And then it's usually straight in and straight back out, okay? That's exactly 3.2 millimeters, which is the exact size of this trocar. So you hold the trocar in the palm of your hand and you're just trying to bury the trocar to the level of the little bevel here. As soon as you have it like that, you take your tension off and then just sort of lift up. And when you do that, it'll usually go straight in. If it goes straight in with no resistance whatsoever, it's in the right place. You take your trocar introducer out. And these trays are these little, sort of your little forceps here. And then you put these in to the introducer sleeve. Then you use your blunt introducer. Push the pellets in. Pull your trocar back out. Use a 4x4 over the incision to let it sit there. Then use one of the steri strips either in there or the ones that I use, which are a little bit wider, so that's why I like using mine and not the ones in the system. You close the incision. Then you use a 1-inch piece of tape. And then what I always do is I use one of the 4x4s, fold in half, put it on this 3M micropore tape. That's the dressing. Now the instructions for the patient are, the dressing comes off tomorrow. I always say get in the shower, okay, get it wet. If your husband can take it off or your partner can take that off, great. If not, when you take it off, try not to remove the tape underneath, because the tape underneath needs to stay on for 3 days. Advise the patient not to have any kind of exercise for the next 3 days other than walking. Okay, try not to do any strenuous exercise. Also, not to get anywhere where the water is not going to be completely clean, which would be beach or lake or anything else like that, for about 3 days. After 3 days, it's usually done and you don't have anything else to worry about. And that is the conclusion of the procedure.